Hi, I'm Julie McIntosh, Director of Education at Compassion Care Hospice. I know if you're considering hospice for yourself or a loved one, you probably have questions. Hospice may be one of the most misunderstood and underutilized of all healthcare benefits, not just amongst the public, but among healthcare professionals as well. We don't like to talk about our mortality, but now more than ever, it's important to know your options and discuss what would be important to you if you were faced with a serious life-limiting illness. In this video, I want to share an overview of hospice and hopefully dispel a few misconceptions. The information shared here is not specific to any one company, but meant to cover the basics required by all hospices. Hospice is a very specialized model of healthcare, centered on palliative care, or what we call comfort care. When someone's illnesses reach the stage where they're no longer responding to treatment and cure is not possible, or the patient themselves no longer wishes to pursue aggressive treatments, hospice is an alternative to conventional healthcare. Although cure may no longer be possible, hospice focuses on ensuring comfort by managing symptoms, providing compassion, dignity, and quality of life for patients living with a terminal illness. Hospice is a benefit under Medicare and is covered 100% under Medicare Part A with no out-of-pocket costs or deductibles. For those without Medicare, hospice is also covered by Medicaid, through the VA for service-connected veterans, and most insurance plans have a hospice benefit as well. The hospice you work with can verify your insurance and explain benefits to you. Hospice care is available for anyone of any age that's diagnosed with a terminal illness with a limited life expectancy. Many hospices provide care to adults, and some specialize in pediatric care. In addition to specialized medical care and symptom management, hospice provides emotional and spiritual support for the patient and their loved ones. The hospice team provides needed education, tools, and resources to give the best possible care while promoting the highest quality of life. The team helps families understand their loved ones' illnesses, prepare for changes, and support one another throughout the end-of-life journey. Most commonly, care is provided wherever the patient calls home by a team of professionals, which include physicians, registered nurses, nursing assistants or aides, social workers, chaplains, bereavement specialists, and volunteers. Home could be a private residence, group home, assisted living, or even a skilled nursing facility. Although one level of hospice care allows for inpatient care, this is meant to be short-term for crisis or symptom management and is not a solution for long-term residential care. A referral to hospice can be made by anyone. A patient or their loved ones can request an evaluation to see if they're eligible, or a healthcare provider may write an evaluation order. Qualifications include being diagnosed with a terminal illness with a life expectancy of 6 months or less if the disease follows its expected course. Now, this is not an exact science, but is based on the physician's clinical judgment regarding the normal course of the disease and the individual's prognosis. Once hospice is started, there are no time restrictions, meaning hospice can be continued indefinitely as long as the patient still meets Medicare's criteria. Patients can also stop hospice at any time and for any reason, such as to resume aggressive treatments like chemotherapy. It's also not a one-time benefit, so if a patient stops hospice but wants to resume care later, they can do so as long as they still meet criteria. There are many hospices here in Nevada, so it's important to do some research. You can look up a provider's Medicare ratings, read reviews online, or ask your doctor for recommendations. Medicare requires all hospices to provide the same basic services, but the quantity and quality of those services can vary from one provider to another. It's recommended to call or meet with several hospices to ask about their services or specialty programs to find the best fit for you or your loved one. Considering hospice is difficult, but it's an important option for someone with a terminal illness. You should feel free to discuss hospice as an option with your healthcare provider. Although they may have recommendations for you, ultimately it's the patient's choice to elect hospice and to choose which hospice they want to oversee their care. If you have more questions about how hospice can help you or a loved one, please reach out to any of the hospices here on Vegas Healthcare. We would be happy to answer your questions.